Let's move on. Now, the United States has informally declared that the full-blown COVID pandemic is almost over. In fact, United States has informally called an end to COVID more out of fatigue. Now, despite a record of 1 lakh deaths due to the Omicron variant, the country's resolve to combat the deadly virus is waning. Democratic-run states such as New York and California have already dumped their mask mandates even before the federal guidelines. Leading COVID expert in the country has said that a full-blown pandemic phase for COVID is almost over and that curbs can be eased. In fact, let me go across to Dr. Rajiv Das Gupta, National COVID Task Force member, for his perspective on this big story. Dr. Das Gupta, thank you so much for joining us. First of all, how do you see this particular declaration, this announcement by the United States? Is it COVID fatigue taking a toll on the Americans, or economic pressures doing the talking here?
Thank you. This has to be read in the context of a meeting of the US president with a bipartisan group of governors 5 to 6 days earlier, pushing for far greater relaxations, if not an end to many of these restrictions, particularly masks. And that's a political imperative across the world. So UK, for example, had reduced the home isolation successively, now down to 5 days, and possibly would do away with that by the end of this month if media reports, going by what media reports indicate. And therefore, that is a growing political imperative across the world. But the fact is that there is a pandemic fatigue. The fact is that both from economic and humanitarian viewpoints, a lot of restrictions will need to be eased, and therefore politicians as well as public health experts and scientists will need to find a common ground rather than unilateral declarations.
But Dr. Das Gupta, how dangerous is this? These kind of announcements, these kind of declaration, the most developed, powerful nation of the world declaring that full-blown pandemic is almost over. Does it set a wrong precedent? Because even the global health bodies, including WHO, have been continuously warning that COVID is not going anywhere. It is pretty much here. And of course, it is a matter of concerns for so many countries.
Yes, such signals are going to be interpreted in various ways across countries. However, this pandemic is somewhat distinct from the previous ones because the vaccine was designed and operationalized pretty early, relatively speaking. It has had substantial coverage in many countries. At the same time, it has been quite iniquitous across the world, and that should be the concern also. And the WHO's viewpoint is obviously from a much wider lens. At the same time, there is a need to move to more local levels of decision making than central. And in that context, India could also well take a review of how much of a central guidance we need and how much of local decisions need to be made, and perhaps it's an optimal mix of these two that should guide at least the Indian situation.
Das Gupta, thank you so much for joining us on this broadcast.